Hey guys, it's Dr. Leslie again. Your instructor for anything anatomy, biology, kinesiology. Today we're going to cover the pelvis, the ilium, the pubic bone, the ischium. Those of you who have watched the other videos, you've heard me say it many times, but because if this is the first video, I gotta have to say it again. I'm hoping these will be helpful, give you a little diversion away from your PowerPoint slides that you're studying, as well as any other handouts or things you're reading. But these should only supplement those notes. I try to be as thorough as possible with these videos. I am not following notes as we go along because I'm really trying to make sure it doesn't sound any more robotic than sometimes anatomy can be anyway. So again, hopefully you find this useful. Keep in mind and bear with me that I'm using, not really sophisticated technology here other than what we usually have in 2018 beyond. So if I do make improvements to these, I'll let you know. All right. So this area, I do have to hold the camera a little bit more, so I'll try to not shake too much. But one of the first things we want to notice we're looking at is we're obviously looking at the anterior side of the pelvis. All right, now why? All right, I may do other videos for the other classes, but we don't see the spinous processes of the lumbar spine, all right? So if we don't see the spinous processes, we know we have to be looking anterior, all right? So first thing we see here is we have three bones that kind of form the pelvis. We're going to have the pubic bone, okay, here. We're going to have the ischial bone on the bottom, and then we're going to have the ilium bone, okay? That's the big bones. If you put your hands on your hips, okay, like you're in the love handle area and push down, you're hitting the top of what we call the iliac crest. So I guess that's the first thing I'll start with is iliac crest across the top of the hip. We kind of move here. Okay, see this protuberance? I'll kind of move it around. You get some vantage point. That's going to be the ASIS, anterior superior iliac spine. Okay, tensor fascia lata is attaching here. Sartorius is attaching here. As we move inferiorly, okay, we're going to hit another protuberance called the AIIS, anterior inferior iliac spine, and rectus femoris, part of the quadricep group, is going to be there, okay? Very commonly the mistake is made that they think it's attaching up here on the ASIS, okay? So if you felt the top of your crest, moved forward, you may feel the ASIS protruding in the anterior side. And then a little harder to feel deep down would be the AIIS. And some people, you may not actually palpate it. Then we kind of come down here towards the pubic bone, the pubic crest. Okay. We're going to have the pubic tubercle, some muscle attachments are going to be there. We're going to have the pubic symphysis, okay, which is a piece of fibrocartilage, okay, between the pelvis. Obviously, in pregnant females, when they're giving birth, there's going to be a lot of movement at that area. Sometimes there can be inflammation in certain conditions that will occur there also. And again, that's going to be more like a amphiarthrosis, right? It's going to be somewhat mobile. This big hole here is the obturator foramen, okay? All right, depending on how someone's pelvis is either anteriorly rotated or posterior rotated, you're going to see these more pronounced. Down, we're going to have the superior rami of the pubis, and then the inferior rami coming down here, and then you're going to have the ischial tuberosity. Okay, the hamstring muscles are going to attach there. All right, so this is your quote-unquote butt bone. All right, now I don't necessarily want you using that, but when you're sitting down on your ischial tuberosities, that's what you're pressing into. And if not, later on, I'll talk about it. Definitely in our lecture, we talk about the sciatic nerve runs through there. So that's why people classically say don't put your wallet in your back pocket. Especially if you have a sciatic issue, because the wallet and all the pressure can push up against the sciatic nerve. But the hamstrings are going to attach there. And there could be tendonitis, bursitis, ischial here also. Now, I'll try to carefully move ourselves around, okay? Now, the hole we're looking at there, all right, is, and I'm going to kind of turn it, okay, is going to be the acetabulum, okay? That's going to receive the femoral head. Hopefully I don't need to put it up against it. I do have it in the room, but because I will need 5 hands, okay, I'm going to kind of move this around as it is, okay, and we put that there, and we just get a different vantage point, okay? So the acetabulum is really going to be where the ilium up here, the ischium from the bottom, and the pubic bone, okay, kind of converge. So there's always a little section, and you may see in the notes that we use in the color category, so they all kind of converge. Even though this is where, when they make these things, to have the hip attach, okay, that would be kind of where the ligament teres and the fovea capitis, where the blood supply would be kind of going into the femur. But you can see how deep this is compared to the glenoid fossa if you've watched the shoulder video. Okay? So you can see how it's a very deep joint. There would be labrum, which is fibrocartilage in the joint. Dancers, athletes, again, you don't have to be an athlete to have it. You can tear the cartilage that's in there. So let's rotate us more posteriorly, okay? Again, bear with me. I think I told you this video is going to be a little bit more wobbly, okay, because I can't pin everything down. So I'm going to go to my right side of my ilium. So here's our iliac crest again, okay, across the top. And as you see here, we come around the front, there's the ASIS. Okay. One thing I should notice or tell you is on the interior surface is going to be the iliac fossa. And I'm going to turn around quickly and we'll get back to that. Okay. This is going to be the iliac fossa right here on the inside section. Okay. Iliacus is going to attach here and then go down to the lesser trochanter of the femur. All right. So let me rotate us back posteriorly again. So here's our iliac crest, good starting point. All right, put your hands on someone's hips, work your way posteriorly. First big thing that we see here is the posterior superior iliac spine, the PSIS. Guess what it's really close to? The sacrum bone, okay, which is what? At the lower portion of the spine, from L5, sacrum. All right, we won't go into that, but that'll be demarcate where the sacroiliac joint is. Next thing is the PIIS, okay, which is going to be down here. Then we're going to have this big groove here. It's called the greater sciatic notch. Sciatic nerve is going to pass through there. Okay, it's formed by some lower lumbar sacral nerves, pierces through. We'll talk about sciatic issues. The next thing is going to be the ischial spine right here. Okay, there'll be some ligaments. Okay, they're going to attach there going to the sacrum, okay, in the coccygeal area. Then we're going to have the lesser sciatic notch right here. Again, most of these we cover in lecture. And then again, we have the ischial tuberosity. Okay, so if I have my client prone, okay, where he's face down on the table, hopefully you're looking at this and you know you're looking posteriorly, right? Because you learned the sacrum from one of the other classes. Here's your coccyx. Okay, this would be where the sacral hiatus is, where the cauda equina is coming out the nerve bundle. Okay, median sacral crest. And then what do we see up here? Our spinous processes. Now, we're not covering the spine today, but if you see spinous processes on pictures, on tests, boards, whatever it may be, you know you're looking posteriorly. Okay? So those are some of the main landmarks of the osteology of the hip. A few things to notice. Okay? We're kind of looking at on the posterior part of the pelvis now. The posterior lateral side, approximately across the crest here, going down, and if I had my greater trochanter, okay, we'd have the posterior lateral side, we have glute medius minimus. Centrally located, we have gluteus maximus. We would have, we got our pelvis rocked here a little bit, but from the sacrum going down to the greater trochanter, okay, we would have the piriformis And then guess what? Here's our greater sciatic notch. There's the sciatic nerve, which most people will pass underneath the piriformis, and about 10% will pierce through it. Okay. And again, some of our gemelli muscles are going to start, gemelli superior, inferior, are going to originate approximately near the ischial spine of the pelvis. So one of the things I want to show you before we end this video, again, as I told you, I'll make some improvements to these videos, but I want to get something down. We talk about anterior and posterior pelvic tilt. So we're looking on the lateral side, okay, where my thumb is the acetabulum. This is where the hip joint would be. This is the ASIS. All right. Now, some people discuss the ASIS as a landmark or the PSIS. If my pelvis goes forward like this, right, that'd be an anterior pelvic tilt. All right. That would kind of accentuate the lordosis or the curvature in the back. And if I rock back this way, it'd be a posterior pelvic tilt. All right, which a lot of times with a posterior pelvic tilt, it may put more traction on the muscles in the lumbar spine. Okay, they may have more of a flat back, less of a lordosis, which is the normal curve in the spine. Okay, so anterior pelvic tilt, posterior pelvic tilt. What motion or what thing that we do all day that causes that? Walking or running. All right, so if your hip is hiking up, doing a hip flexion, your pelvis is going to typically have a posterior pelvic tilt. Okay, if you're kicking backwards or bringing your leg back, legs going back into extension, you go to an anterior pelvic tilt. In kinesiology, we will talk about Gillet's test, that we palpate the sacrum and the PSIS, and we're checking this rotation. So again, I'm going to end that video there. Okay, we will make some improvements. Again, please, please, please only use this as a supplement. I'm hoping if you see it in video format, it will help you as you're learning it from the hard notes. Okay, have a great day, guys. Take care.